It is right at the 9 o'clock hour. So while folks are continuing to log on, I will go ahead and kick us off here. So welcome. My name is Blair McGarry. I am the Executive Director of the Summit Chamber of Commerce, and we are thrilled to be here with this great panel of experts today to discuss the future of healthcare. We've got a lot to cover, so I'm going to make it short, but this conversation is so important and highlights the partnership between the Chamber and Peak Health Alliance. Both organizations are laser focused on local solutions that enhance the prosperity and success for businesses and individuals. I think it's really important to note Peak's rate reductions have saved over $7 million for its members, allowing those dollars to be spent elsewhere in our community. So some quick housekeeping items. We will have time at the end for a Q&A, and we invite all attendees to ask your questions in the Q&A panel. Attendees are in listen-only mode, and again, are encouraged to ask questions through that Q&A panel. We're going to do our best today to get to all of those questions. However, if we do run out of time, we will reach out directly or provide an FAQ sheet that will kind of highlight those high-level questions for everyone. So with that, I will turn it over to Claire Brockbank, CEO of Peak Health Alliance.
Thank you, Blair, and thank you so much for hosting this with us. So thank you to the panelists, but also to our participants. As of this morning, we had about 250. Good morning, Senator Bennet. We're just starting.
Hi, Claire. I apologize for being late. Please don't let me interrupt.
No worries at all. I do want to thank also our participants. As of this morning, we had about 250 registrants. They've come from all over the state and actually all over the country and represent a pretty diverse set of interests. We have providers and insurers. We have individuals who are concerned about the price of healthcare, to businesses who are trying to reopen after COVID and figure out how to attract and retain employees by offering affordable coverage. We have academics and their students, which makes me particularly happy. We have local, state, and national policy experts, and we have single issue advocates as well. So it's a really diverse group. Many of you sent questions in ahead of time. We've screened all those and tried to consolidate them into some of the questions, but we will commit, as Blair said, to distributing answers to any of the questions that we don't get to today. So before starting, I'd like to introduce our panelists. So Senator Michael Bennet, AKA Kristen Mollett, who is his amazing scheduler, has represented Colorado in the Senate since 2009. He served as the superintendent of Denver Public Schools, where we were introduced to him with kids in the Denver public school system. He's been a managing director of Anschutz Investment Company and was chief of staff to then Mayor John Hickenlooper. In Washington, Senator Bennet really tries to work across the aisle. His issues have included child poverty, education, immigration, national security, and of course, healthcare. He's worked tirelessly on the expanded child tax credit, which has now been included in the American Rescue Plan. So congratulations, Senator Bennet. That's a big achievement. But today we'll hear more from the senator about Medicare X, his plan to achieve universal, affordable, accessible healthcare. He has a degree from Yale, and we can thank his then fiancee, Susan Daggett, for bringing him to Denver, and his 3 daughters for keeping him grounded and focused on policies that will serve future generations of America. I should also note that the senator has a vote towards the end of this session, our hour, so he will be departing a little bit early. We will, however, be working with the staff to make sure that we get unanswered questions addressed after his departure. Next, we have Representative Dylan Roberts. He has represented House District 26 in the House of Representatives since 2017. His work at the legislature is really focused on lowering the cost of healthcare and prescription drugs. And that is what we will, among other things, which is what we will focus on today. He is the author of the Colorado Public Option legislation, which is currently consuming a lot of energy and print media and all sorts of other things. So we will for sure talk about that today. Dylan truly understands his district. He grew up in Routt County and he now lives in Eagle County with his fiancee, Sarah, and their rescue dog, Hattie. I think everybody on this call has dogs. Next, we go to Kathrine Mulready. and she is the Senior Vice President and Chief Strategy Officer for the Colorado Hospital Association. She's responsible for public policy priorities at both the national and the state level. She also coordinated healthcare issues for Governor John Hickenlooper. She has a joint degree in law and healthcare leadership from the University of Denver. And when you look at her bio, collaboration is a pretty common theme across many of her professional and extracurricular activities, which is a word that resonates pretty deeply with Peak Health Alliance. Kathrine has twin boys, so in her rare off hours, they keep her pretty busy. Adela Flores-Brennan is the Executive Director of the Colorado Consumer Health Initiative. CCHI works to improve access to healthcare for all Coloradans by promoting healthcare equity, affordability, and quality. Prior to CCHI, Adela was the Director of Community-Based Assistance Programs for our Colorado Marketplace, Connect for Health Colorado. She has a law degree from the University of Colorado and has served as the board chair for Connect for Health and on the board of Colorado Access. We are looking forward to Adela's unparalleled perspective on consumer healthcare needs. When Adela's not working, she has kids, dogs, and a garden to keep her busy. So last but not least, we have Jack Hooper, who is the CEO and founder of Take Command Health. Take Command is a business that helps companies and individuals manage health reimbursement accounts, including individual coverage HRAs or ICRAs, which for those of you who follow Peak know it's a tool and a mechanism for coverage that has been very popular with many of our small businesses. Like many entrepreneurs, he started Take Command Health as a result of personally experiencing the frustrations of working with the healthcare system. Jack was an intelligence officer for the FBI and the CIA, and he has an engineering degree as well as an MBA from the Wharton School of Business. But I would say despite all those technical skills, he's really a whiz at translating complicated healthcare issues into plain English. And that's going to serve us really well today. So thank you, Jack. Like Kathrine, he's the parent of twin boys, although he has a third boy as well. So we are hosting this event. People have asked in the questions, why is Peak doing this? And this is really part of our commitment to informed community dialogue about affordable healthcare coverage. Community dialogue and input is really what led us to start Peak in 2019 as a way to take action to drive down insurance costs. It was community dialogue and that was the catalyst for those 6 additional counties we expanded into this year. And it was hearing from members in our communities that caused us to redesign our healthcare benefits to really promote value without sacrificing premium reductions. So we take this kind of community input really seriously, and we're sort of excited to see where today's dialogue leads us. So I'm going to start with a kickoff question for each of our panelists, and we'll start with Senator Bennet. From your perspective, Senator, from your federal perspective, what are the most important actions that the federal government can take to drive healthcare affordability in both the short and the longer term?
Thank you, Claire. And I just want to say thank you for your extraordinary leadership and for inviting me to be part of this conversation and to join the panel with such thoughtful leaders in Colorado. I'd say a couple of things. One is I have spent the last year of COVID, I suppose we don't have to call it the year of COVID, but February to February during COVID, traveling to every single county in Colorado to try to make sure I understand what's happening, what's happening across our state and what the needs really are. And I think COVID has highlighted the need for everyone to have access to testing and treatment and vaccines. And I would say primary care. And so right now, the thing I think in the short term we need to do is implement Joe Biden's American Rescue Plan, which Congress passed into law in March. That plan has $7.6 billion of public health, a public health program similar to my health force proposal, which I wrote after figuring out that we were terribly underfunded in our public health system in Colorado. And it also improves emergency Medicaid and coverage of COVID testing, treatment, and vaccines for the uninsured, including undocumented Coloradans. And importantly, it improved premium tax credits so that people earning below 150% of the federal poverty level can access care without paying any premiums, and those earning above $400,000 of the federal poverty level pay no more than 8.5%. of their income on premiums. Every early data from the Colorado for Health, from the Connect for Health Colorado suggests that these new tax credits that we just put in will save Coloradans anywhere from 17% to 66% on premiums. So that's something we're doing right now. The American Rescue Plan puts these tax credits in place for 2 years, but I believe we need to make them permanent. And there's good news because we just learned this morning that the president's American Family Plan includes making these credits permanent. Beyond that, I remember being in Dylan Roberts' district, which he does represent incredibly well, and being stopped by somebody in Routt County who said to me, Michael, why, after we passed the Affordable Care Act, why are you making me buy something that's useless to my family? And I said, what do you mean? And he said, I mean insurance, because the deductible is so high, and by the time when I need to use it, nobody will return my calls, and I said to this person, who, by the way, was a pretty conservative Republican, I think you have a very insightful critique of the Affordable Care Act. And so that led me to introduce a bill with Tim Kaine from Virginia called the Medicare X Choice Act, which, among other things, creates a true public option. This bill aligns with what President Biden called for during his campaign. He called for a true public option, ensure that every single American has access to high quality, low cost health coverage. I think it's the best solution to reduce health costs while expanding access to care across the country. Our plan would start in rural areas where there's one or no insurers, like parts of Colorado, to increase competition in the health insurance market, and people would have the option to buy in if they want. And then over several years, the plan would migrate to everyone in the country and become available to every small business. It would ensure that healthcare plans cover primary care without any copays. Our bill also includes several reforms to bring down the cost of healthcare. It uses Medicare and Medicaid networks and contracting to create efficiency. It allows Medicare to negotiate drug prices for the first time on behalf of the American people, to take advantage of the program's huge purchasing power. So in my view, this bill helps finish the work of Obamacare. It gives our families and workers a choice and puts more money back in their pockets. And Tim and I reintroduced Medicare X in February. I've been on the phone with the White House since then, and we're going to be doing everything we can to try to get it across the finish line in Congress.
Thank you. So that's a natural segue to Representative Roberts. You have been a little bit busy this legislative session, and so could you help our audience understand how the Colorado Public Option Bill, as it in its most current iteration, compares to Senator Bennett's Medicare X, and some of the compare and contrast in terms of how it serves Colorado?
Absolutely. Thank you, Claire. And it's an honor and a privilege to be on here with Senator Bennet and Adela and Jack and Kathrine as well to talk about this important issue. And this is by far the #1 issue that I hear about from my constituents in Eagle and Routt counties. As Senator Bennet noted, I hear those stories all the time from people in Routt County. And both of my counties are 2 of those counties where there is only one choice on the individual market right now if you're buying insurance on that market. So this is why I work on this issue and why Senator Bennett's Medicare X bill would be so valuable to my district, but the whole state and the country as well. But while Senator Bennett's working on his bill, we're here in session here at the state capitol, and we move pretty fast. We only have 120 days a year, so we are pursuing a Colorado option that I think would work well with the Medicare X program, or would fold into the Medicare X program if that did get passed as well. But we need to get started right now here in Colorado. And so we are pursuing this Colorado option idea, which unlike Medicare X, we cannot tap into the national infrastructure that is Medicare. On a state level, we can only work within the 4 corners of our state. And so what we are doing in the most recent iteration of the bill that we worked very closely with Kathrine and others on this to get this bill in a place where it's moving along now, is to build a new option into the already existing insurance market. But we're going to do a couple things. First, we're going to make it a quality plan. So it'll be a new standardized plan that comes with essential health benefits, comes with an affordable deductible so that people can actually use the insurance, and covers things without out-of-pocket costs. And so we're going to create that standardized plan, and then that standardized plan will be available from at least one carrier in every county in the state. So we'll add this new choice, this new option for consumers no matter where you live. Our plan is going to be available on both the individual and small group market, which is really exciting because we get to help small businesses too, who have been particularly hurt by the pandemic, but even before then, always struggled to buy affordable health insurance for their employees. And then we will, by exercising these savings, we're going to be able to use money coming from the federal government and put that into a fund that will allow people who struggle to buy insurance be able to pay for their insurance. So ours is kind of a quasi public-private partnership, if you will. It's probably the best or the truest version of a public option that you could do on a state level without being able to utilize the national Medicare infrastructure. And that's where Senator Bennett's plan would come into play. So that's sort of how those work together. You know, I think both could pass. I hope both pass, and they would both work very well together. But we look forward to passing our bill this year in the next month or so, and those savings will start to be realized by Coloradans pretty quickly.
Thank you. Adela, when Peak thinks about affordability, we think of it as a combination of premium and removing barriers to access care. So Senator Bennet, Representative Roberts, we actually have products that have a zero deductible in the bronze and silver level, and we waive the deductible for services like primary health care, outpatient doctor's visits, the kind of lab and diagnostics you need for a doc to make a good diagnosis, and very importantly, for all outpatient mental health therapy. So we think about affordability as that mix of access and the premiums, which have dropped an average in Peak by 35%, you know, in the private market. Adela, when you think about affordability, what else is missing? How do we get consumers to think about affordability and act accordingly?
Thanks, Claire, and thanks for the invitation to participate today. And I think you know, the story that Senator Bennet shared about a constituent in Routt County is very much also how we think about affordability. We think about it both at the premium level, and that's what you're paying out of pocket on a monthly basis to keep your insurance product if you're paying for your insurance, and then also all those costs that you have to incur when you're accessing care. So we've heard from people around the state that they will buy a plan that they can afford, but then they can't afford to use it. And so we really have to think about affordability holistically to include not just the premium costs, but also those costs to access the care as you suggested. We also like to, or we've started to think over the last few years about the flip side of affordability, which is how are we controlling costs in the system, or what can we do to control costs in the system so that we're not adding to the affordability burden for consumers and how much they have to pay. So we've been looking at various ways that we can control costs. Right now, we're working on some legislation to help control costs of prescription drugs at the state level. And then, you know, when we're not working on systems level advocacy to change laws or change regulations, we're helping people on an individual level to navigate the healthcare system and advocate for themselves to help find financial assistance to help pay for their coverage, to apply for affordability programs, to negotiate their bills, and that type of thing. So, you know, we can help people on an individual level while we're working all the while on those systems level changes that will hopefully help control costs for everyone.
Thank you, Adela. And that's actually a great transition. So Kathrine, hospitals are clearly a pretty important linchpin in our healthcare system. And in Peak's rural communities, they're really a critical community resource. So we really commit to always saying we're not going to shut down a local hospital, but we nevertheless they do contribute a significant part to the healthcare spend. So that's always that balance. But what are you and your organization, Colorado Hospital Association, doing to promote affordable healthcare in the next 1 to 3 years in Colorado? So I know you've been really busy up till this point, but as you look forward, what are some of those things that you're doing to keep moving the needle on affordability?
Thanks, Claire, and thanks to my fellow panelists today for all of your work in all the spaces that you're working in. You know, Claire, one of the words you just mentioned is balance, and I think for us, it is a delicate balance. So CHA represents over 100 hospitals and health systems all across the state, the largest, the smallest, specialty, acute care, tiny critical access hospitals, really the entire healthcare community and hospital community in the state. And for our members, it's really that delicate balance of affordability, but without sacrificing access to care and the quality of care that we provide to Coloradans and people from outside of Colorado, literally 24/7, 365. So certainly we work in both the policy space at the state and federal level. Huge kudos to Representative Roberts and to Senator Bennet for the work that you're doing. But we also believe in market-based approaches, and there's been a lot going on over the past 4 or 5 years even, some of which is just starting to come to fruition. One of the first initiatives that was championed by CHA in terms of affordability was legislation we passed back in 2017 that's just getting implemented this year. It had a little delay due to COVID. That's the Hospital Transformation Program, and really working with Medicaid, who's a huge purchaser of care in Colorado, to ensure that we have value-based care and we're improving the value of healthcare we're providing, particularly to Medicaid recipients, but really changing the systems through the lever that is Medicaid. We partnered to fund the reinsurance program that has reduced premiums by 20%. We're a partial funder of that program. Certainly in the state policy space, the Health Insurance Affordability Enterprise, which was created last year, I believe Adela sits on that board, and has just approved cost sharing reductions for 2022. We see all of those as really key components and places where hospitals can really be partners in bringing affordability to more Coloradans. Again, in the policy space, where we're really focusing on these market-wide approaches that impact the entire healthcare dollar, and align incentives for all players to really work together. And that includes hospitals, that includes other providers, payers, patients, and the communities to really improve affordability, but more importantly, I think to improve value, because the affordability is always a balance of the investments we need to make to continue to provide access and quality, but at the same time improve affordability for Colorado consumers. Representative Roberts talked about the public option bill. We can certainly come back to that if the participants want to dig deeper into the details. But I think equally importantly to the hospital association, as what we're doing in the kind of public policy sphere, is what is actually going on in the market. We believe really deeply in voluntary market-based and community-oriented solutions like PEAK to really address healthcare on a local level. So I could probably talk for the remainder of our hour about particular examples of how hospitals have really come to the table to partner with school districts and businesses and chambers of commerce and other provider groups to deliver real savings to Coloradans. And the advantage of those market-based solutions is that we're not limited to just what's regulated at the state level, but that we can really probe into to places like the large group market, where we can have the most impact and deliver better out-of-pocket experiences, Adela talked about, or more comprehensive coverage, or address a particular community issue like behavioral health that varies a little bit across the state. So I'm happy to go into details later, but I would say on affordability, what we're doing is working. In the individual market, which is kind of our best proxy for kind of where our state investments are going, premiums, even before the reinsurance program dropped in 20%, premiums have been holding flat or decreasing a little bit for the last couple of years. And that's evidence that what the market is working on, it really is starting to pay off for Colorado consumers.
Thank you, Kathrine. So Jack, certainly not last but not least, In Colorado, premiums are about 20% less expensive for individuals than in the small group market. And a lot of that is due to the reinsurance legislation. In peak communities, individual products can be as much as half the cost of a similar product in the small group market. The Colorado public option would mandate 18% reductions in both the individual and the small group market over the next few years. But what that means is there will still be a pretty big differential between the individual and the small group market. With that in mind, because those kind of mandated reductions tend to get kind of locked in. With that in mind, how do you see the group market evolving over the next few years?
It's a great question, Claire, and want to thank you and the other panelists for allowing me to join. And as you mentioned in our intro, and as your question implies, Take Command Health, we help employers set up the new ICHRAs, or individual coverage health reimbursement arrangements, which is a fairly new phenomenon. It's only been available about a year, but we're starting to see some really powerful traction, especially in Colorado. So Colorado, on a per capita basis, is actually the national leader in implementing ICHRAs. And I think it points to a few reasons why and things that we're learning. So if you're not familiar with what an ICHRA is, it's essentially an individualization of the group market, where employers, instead of providing a small group plan or a large group plan, can offer employees a tax-free stipend to go purchase an ACA qualified plan on the individual market. And a few stats just to share real quick and come back to your question. So in Colorado this year, 70% of small businesses offering an ICHRA or offering benefits for the first time. So we're truly expanding coverage with this new model. For larger employers, 30% are now offering stipends towards ACA care instead of a MEC or a skinny plan. So for those larger employers, we're providing dollars that are going towards high quality care, which is really exciting. And Claire, to circle back on your question of, well, how do these dynamics, change kind of the group to individual relationship? I'm so excited to hear, from Rep. Roberts and Senator Bennet about Medicare X and the Colorado Public Exchange. More options for Coloradians, is, I think, going to drive that desire to or movement to the individual market. And it's a really good thing for two reasons. One is it empowers employees, it empowers consumers to understand those choices. If hey, I want the narrow network HMO or the broad network PPO, I'm starting to ask those questions appropriately to understand where my care is going to come from. And then secondly, it really puts, you mentioned the cost differentials. It really highlights, I think, the power of the individual market and the negotiating that's going on. And that's only going to accelerate with the public option or Medicare X or these other policies where, hey, we are able to pull down costs. Peak is such a great example in the counties that you all serve, watching the costs come down over the last few years. That's where the true negotiation, happens. The group market, it's functional. We've relied on it for a long time, but the reality is employers are not good negotiators of healthcare. And as costs have gone up and up and up, negotiating through the exchange, through the public option, through Medicare X makes a lot more sense. And then giving employees a chance to buy into that plan. Employers still want to provide a benefit for recruiting. And I think everyone agrees we want employers to help with healthcare, but we really don't want them negotiating deals. I think if they can give money to employees to go purchase a plan, that's going to be a better route. So long term, I see it's a good thing. I think we'll see an accelerated transfer of employers in the group market moving to this ICHRA model, putting more lives and employees into the individual market, which only makes those negotiations, better and better.
So Adela, we've seen some Democratic hesitancy about ICHRAs, but do you see as we're now coming out our first year, et cetera, and Colorado is a leader, and I would say that's probably because of peak, because frankly, we could not get an insurance carrier to work with us in the small group market. So there's a problem there, right? We think we may have fixed that for next year. We're optimistic, but nevertheless, do you see a problem, Adela, with employers choosing to offer ICHRAs to their employees instead of a traditional small group product? Do you see some issues with that trend that we're seeing?
I don't know that I necessarily see issues with it. I think, as Jack said, it really helps to increase the number of choices that small businesses have for providing healthcare for their employees. I know some small businesses want very much to do the traditional offering of coverage to pay part of the premium, and others probably don't want to have to worry about that. And so and I think there's a lot of other factors to consider about what how a business is going to proceed. So I think it just helps to improve on balance the choices that a small group has. And Jack mentioned too that these are ACA plans, and so we can be assured that there's a good benefit or a robust benefit package that people are buying into.
Okay, thank you. I'm going to switch a little bit. We've had a lot of our registrants and then some of our questions in the sidebar raising the issue of administrative costs, and both Medicare X and the public option rely on the current mostly for-profit insurance companies to administer care. Medicare enrollment is dominated by commercial Medicare Advantage plans. And the Colorado public option, as Representative Roberts, has shifted away from a state insurance entity. So Senator Bennet, how would you address the single payer advocates' concerns that this ignores the almost 35% that we spend on administrative costs?
Well, look, Claire, I'm glad to have the chance to answer that. And also, I'm going to have to leave after this because I got to vote. And Gina Rodriguez, who's our appointee to the Colorado District Court, is here too, which is wonderful, amazing thing. What a great question. Look, first of all, at a meta level, let's consider the fact, even beyond including administrative costs, we spend twice as much as any other industrialized country in the world on healthcare. And that has huge cost to our society. The fact that we spent decades and decades and decades not investing in our infrastructure, among other things, is a reflection of those high healthcare costs. It is not sustainable, and it is making our economy and our country uncompetitive in the world. So we have to address this problem. The public option actually does create huge savings in terms of administrative costs, and that's why it's going to be able to offer a cheaper form of insurance that's still high quality. But I think the fundamental point is this: we need to achieve three things in our healthcare system. One is we've got to reduce costs. A second is we got to make sure that we've got universal access. And if a global pandemic doesn't show you why we need to do it, consider the different health outcomes that people have had based on whether they've had insurance or not. And third, we got to preserve and enhance the quality that we have. And my belief, my strong belief, is that I will be dead, that we'll all be dead before we create a system in the United States where the 180 million or so people that have private insurance, or the tens of millions of people that have private insurance, willingly give up the private insurance they like. There are plenty of people that hate private insurance, and for good reason. There are other people that have private insurance and they really like it, because they've negotiated for it with their union, or they've negotiated for it with their business. And I don't think a reasonable starting place for getting to universal healthcare is to take it away from them. But I think the problem is incredibly urgent. And it's because I think it's so urgent that I chose to go down the road of the public option, because I think that's the way we're going to be able to get this done. Just to close with one more story from Colorado. In Jackson County, which is a county next to Dylan's district, it's not actually in his district, and a place where the last time I was there, I had to apologize because I did so badly in my last election there, because there's like 10 Democrats in the county. We had a meeting with 25 people, and only 2 had health insurance. And there was a guy who had come back to Jackson County to buy and I'm sure Dylan knows this place in Walden, to buy the bowling alley who said, my wife and I are working 50 hours a week and neither of us has any health insurance because we can't afford it. And at the same time, I can't hire people to come work in the bowling alley to give us a break, even though I want to. Why can't you hire them? Because if they come work for us, they'll make too much money and they'll lose their welfare. What do you mean their welfare? Medicaid. That's the system we have today, where people working 50 hours a week can't afford health insurance. People that would like to work can't work because if they work, they give up their health insurance. I think we have to recognize the pathologies of that system. And I believe the quickest way for us to overcome that is to give everybody in America a true choice about whether they want to hold on to their private insurance if they have it, select a public option if that's what they want. But no matter what you believe in, single payer, public option, we have a huge amount of work in front of us to fix the incentives and disincentives in the system so we can deliver a higher quality at a lower price.
Thank you. I appreciate, and I know you do have to go for a vote.
Thanks, everybody. It's great to see you. Dylan, thank you for your leadership in the State House.
Senator Bennet, we'll work with your office on getting other questions answered that come up that are directed.
Great. Well, any question people have, I'm glad to answer, and you don't have to just ask about healthcare. Take care. Bye.
Bye-bye. Kathrine, I'd like to shift to you. We've had lots of folks talk about price transparency, and one of the ways that we've tried traditionally to we've tried unsuccessfully for the most part to engage consumers in becoming a better shopper with the belief that that should be part of any action to reduce cost. And one strategy is to promote price transparency so that consumers can actually find out how much it will cost to get a service at a different hospital. As we know, the same service at a hospital next door to another hospital can be dramatically different in price, and it can be dramatically different if you have Anthem coverage versus Cigna versus Peaks coverage with Bright, same hospital. So as of January 1, the federal government actually requires hospitals to post prices they've negotiated with different insurance companies on the web. We did a spot check. We checked every single system in Colorado, and I will say that the one that is truly working hard to meet the intent of that is SCL, the only one, to be really honest. There's some efforts, but they're pretty hard for a consumer to navigate. We looked at some of the independents, but I will be honest, we looked mostly at the system. So is CHA doing anything to promote compliance with that federal requirement to post prices for shoppable services in a more consistent, consumer-friendly way?
Yeah, that's a great question, Claire. So yes, the Hospital Association has long been a proponent of price transparency. As you mentioned, because it varies significantly across payers, we actually believe, as does HFMA at a national level of the healthcare finance experts, right? From a report dating back now, 7 or 8 years, that the best place for consumers to go for that information, if they are insured, is their insurer. Because of the complexities of in-network and out-of-network, it's just very hard for a consumer to go directly to a provider and get that information. That said, yes, there is a federal law that requires us to post that. I think probably the greatest opportunity inherent in that law is that we have to post it in a machine readable format. And as a result, I think you'll start to see a lot of kind of apps or other tools developed with that aggregated information that make it easier for consumers. Not that there's going to be, spreadsheets that are hundreds of pages with every possible procedure you could get at a hospital. That's probably not ever going to be consumer friendly, but the machine readable format component of that. In talking with our members, I would acknowledge that a lot of their implementation of that law was delayed largely because our efforts in 2020 and continuing today even are very much focused first and foremost on COVID. That implementation date was set prior to COVID and did not get pushed back in the midst of the federal administration transition. And so a lot of our members are still working to come into compliance with that law, but anticipate being able to do so in the next several months. So I will just totally own that it's a work in progress. It's also a highly complex law that really does require a lot of information to be pushed out. And I think we'll start to see really the fruits of that effort probably towards the end of this year.
And I would clarify for members are in our audience that it is for shoppable services. So it is not for the complex open heart surgery, et cetera, which you should talk to your insurance company about. But these are procedures like, what is a normal baby going to cost and what is a C-section going to cost that consumers should be able to know and understand. Adela, Representative Roberts had to leave for a vote. I know you've been working closely on the public option. Is there anything in the current legislation to promote price transparency? And if not in this one, are there other efforts happening on the state level? Or is this something that we're watching because the feds have taken action on?
It's definitely been an issue that we've looked at over time, and there's legislation around, transparency with respect to freestanding emergency rooms and things like that. We're also working. There's a significant element of transparency in this Prescription Drug Affordability Board legislation that we're working on. In the public option or the Colorado option legislation, Representative Roberts mentioned that there's a standardized plan component, and I think that will go a long way to helping people understand their benefits and compare. We've been saying that make apples to apples comparisons for a really long time, and I'm not sure if we've really been able to bring that about, but one of the goals with a standardized plan is to make sure that each carrier is offering a very similar product so that people can compare. And so that'll help from the, in terms of transparency from the health coverage side of things. And I think there's still going to be work to do with respect to transparency throughout the system. But as you noted, the transparency is great for those shoppable services. And it's great if you have a more open network. My network is pretty closed, the plan that I have. So it's not super relevant to me as a consumer to be able to shop around. And also you don't always have the option or the opportunity to shop if something emergent or urgent is happening. And so I think we have to be realistic about what we can accomplish there. That said, I think transparency is incredibly important for policymaking, and just putting, shedding a little sunlight onto all of those elements, complicated elements that infuse the whole healthcare system, so that we can begin to make it more simple and create higher value for consumers.
Thank you. It's interesting because we, again, and I'm now scrolling through our audience's questions, so we're gonna hop around a little bit. But one of the themes that we've heard is, people saying, how do we access affordable care? There is no affordable health insurance. And yet we know, Adela and I both serve on the board of Connect for Health Colorado, and we know that many people do not actively shop for their health insurance. We know that many employers do not consider alternatives that would lower premiums while continuing to provide access to basic care with no deductibles. We know that in part from Connect for Health Colorado, but we also know from Peak, where we are always the lowest cost provider. And as we've said before, we already do offer the zero deductibles and the primary care, et cetera. And yet half of the people in the community will pick a Peak product. And I'm going to go to Adela again. Sorry, Adela. And then I'm going to go to Jack and then flip to Kathrine on this. But do you think that even though there are some affordable things, coverage that is, less than $100 a month, a lot of people in Colorado who are eligible but don't enroll, eligible for subsidies but don't get them. Do you think that's due to a lack of awareness on the part of businesses and consumers? So how do we help people know what's out there, or do you think it's something else, Adela? Like, what do we do to get people to use what at least is available out there now?
I think there's so many factors that go into that. I think it's a combination of things. It's a combination of belief systems. It's a combination of awareness and education about what's available. It's also a very subjective belief about affordability, and it may, I'm saying subjective, but it's maybe objective when you're looking at it for yourself, right? We may think amongst ourselves that a less than $100 a month, it seems affordable. But when you've got other bills, if you're low income or on a fixed income of some kind, if you're trying to pay off college loans, then that's not affordable to you.
Right.
And so I think that's something we have to keep in mind, that affordability means something very different for people. And as we mentioned earlier, just getting coverage is the first step, but then being able to translate that coverage into access to care that you can actually afford is a completely different thing. And so if people aren't seeing the value of that coverage in terms of it getting them access to the things that they need at a price that they can afford, then we still have work to do. So I do think there's a lot of awareness building that we have to do. I think the American Rescue Plan Act did really significant things for affordability in terms of premium. And so I think that's really going to make a big difference in people's lives. There are a lot of people who are going to be eligible for $0 premiums, and people who before weren't eligible for premium assistance are going to have that eligibility now. And that's really important. So I think we do really need to educate people, because that could really help bring people into coverage moving forward.
And Jack, on your platform, you're really the first stop for many employees to pick their product. And you've made the comment that choice is good. And we've had people on our chat and on our questions say, I don't want a basic plan, I want a rich plan, or I want an affordable plan, and I don't care if I can't go to whoever, Stedman. So and again, that it's not just about the premium, right? What's the role of a platform like yours, or technology maybe as a whole, to really help people navigate that extraordinarily complicated at times set of trade-offs? Do you talk about premium versus coverage, et cetera? What's the role there for technology?
Yeah, great question, Claire. It's something we get really, really passionate about, because most people, the day they're choosing an insurance plan, it's not usually their favorite thing to do, right? It's their first day on the job, and the HR hands them a form, and they don't even know where the bathroom is. They're trying to check a box, or hey, they're shopping on the Colorado Exchange, and there could be hopefully there's great options there, and that's where I love the discussion here, this group, about making sure there's good options, making sure there's transparency. But it's probably not their favorite thing to do, right? But the reality is that's the start of their healthcare journey. And if they don't understand what's behind it, or what options are in network, where their care is going to be, it may be a quiet Tuesday, and 6 months later, they sprain an ankle or something, and they're already off on the wrong foot, and they don't know it. So a lot of what we do at Take Command stems from research that I worked on back in graduate school. I'm going to pull off some things, but we would give people scenarios, and these were smart MBA students, and we said, hey, here's the health plan criteria, and here's what you're shopping for, and 90% of them got it wrong, just understanding the math and how it works. So I love the things that Adela is talking about with these standardized plans. And I love the efforts on the hospitals to make things more transparent. We look at that as our role as a platform, like, hey, now it's our job. If we have those tools and pieces, it's our job to help those consumers as they start their journey, understand, what their needs are, what the risks are. There was some research, I I won't be able to remember the source, but I remember is 80 or 90% of healthcare costs are actually known before. Hey, I know I'm a diabetic, I know I'm an asthmatic, I know I need this, or I know I'm relatively healthy and I have to go to urgent care once or twice a year. Those things are actually relatively plannable, and we can help people make much better decisions, assuming that there are options and that there are, some transparency tools and data. That Kathrine was talking about, those big spreadsheets. Those are definitely not consumer friendly, but we are so excited and so passionate about getting those, because that's where, as a technology service, we can help empower consumers. We can read those big spreadsheets and turn it into something that's going to be useful, hopefully.
So I'm going to switch gears here a little bit. Again, pulling through the questions. Kathrine, I think we have a tale of two states, at least, when we think about Peak's experience in the 7 counties we're in, where we've collaborated very closely with our hospitals, but it did not come easily. It took some unfortunate high degree of public pressure. We also have many communities that have flat out said, we will not work with Peak, or we will not work with, the doom and gloom of the Colorado public option. So there's been a lot of hand wringing, right, about the 18% over 3 years. Peak produced much more than that in a shorter period of time, but it had to be very, very focused effort. And we have communities who've said, forget it. We have a very comfortable hospital profit margin. And so there's a lot of strong feelings being reflected in the Q&A about hospitals, and getting hospitals to step up and realize the world has changed, and that it doesn't have to be, there is a world of difference between shutting down a hospital and working to support a community. Walk me through why some hospitals, Middle Park Health, St. Vincent's, Animas Surgical, Centura with us, have been University, Children's, they have all been willing to participate and really work hard. Why are so many so reluctant to engage in this new and changing healthcare system, whether it's Peak or something else that's truly an open, not a closed collaboration among hospitals, but an open community negotiation? What are your thoughts about that?
Happy to tackle that, Claire. So first of all, thanks for giving recognition to the many hospitals and health systems that have come to the table with you or with others.
Grateful.
That's a good and long list. I can't speak to any particular hospital or their reluctance. I think, on a statewide level, really important to recognize that about half of hospitals operate at a margin that is less than what is required to maintain long-term sustainability. And our top objective and our top obligation to the communities we serve is to continue to have care available to meet the needs of our communities. Because if there's no hospital, right, it doesn't matter what your insurance looks like very much. So again, I'm not speaking to any particular hospital or health system or anything. Some of them have already engaged in partnerships to make healthcare affordable through other products, whether that's through a different payer than Peak, perhaps, or with a different market segment, working with their chambers of commerce, working with their school districts and counties, working with other private employers in their sector. So what we do know is that there's a lot of that collaboration going on. What we also acknowledge is that affordability is a challenge really across a variety of market segments and looks very different community to community across the state. And so what our members have committed to and remain committed to is trying to work with local partners to figure out kind of where their concessions are needed most, and hopefully navigating to something that can enable them to continue to provide the high quality care they're providing, but also support the communities, both through providing care and making healthcare more affordable. Going back to the previous question that you asked of Adela, the Colorado Health Institute just put out what I think are really disheartening numbers, that 265,000 Coloradans are eligible for Medicaid, CHIP, or APTCs and aren't taking advantage of those for a variety of reasons. particularly on the Medicaid side, this is virtually no cost coverage, right? There is no premium for Medicaid. There are some kind of point of service low copays, but you have over 80,000 Coloradans who are choosing not to access that, despite it being kind of affordable by definition, right? It's virtually free. And I think that really shines a spotlight on something that we need to focus on more as a state, which is we're providing a lot of these services. And even to your point about kind of the small group employers or employers in general, kind of not always looking for the lowest cost option, right? There are affordable options out there, but they're not being taken advantage of by employers or by individuals purchasing care or accessing care, I should say. And we have done very little as a state to really address how we help people access more affordable healthcare.
I think that's a very valid point. And it does get to the how do we make sure we use what is currently available so that we know who is still left out in the cold, if you will. A couple of other questions. I'm going to do this. We only have literally a couple of minutes, so I'm going to do this rapid fire to the three of you. Biggest game changer in 2021. I'll start with Jack because he's in my upper corner and work my way around. So it's going to go Jack, Kathrine, Adela. Biggest game changer.
Oh man, I think these for us, the way we look at the market and insurance and that consumer journey, you know, the state actions that are going on, you know, and Colorado has really been a leader here. You know, are the biggest game changers. I think, you know, now we'll see if it all passes, right, and how it gets implemented. But it's exciting seeing effort kind of being focused on this part of healthcare. I feel like insurance is usually the forgotten part of healthcare, but it's front and center again.
It's certainly not the one anyone likes to admit working in.
Right.
Kathrine.
You know, without question for 2021, it's been the new subsidies available in the individual market through the American Rescue Plan. I know Senator Bennet spoke to that at the outset of the hour, but the kind of updated numbers we've heard from Connect for Health is that 3 out of 4 Coloradans in the individual market can access healthcare for premiums less than $25 a month, which you know, is a huge stride forward. And I think just this morning, the President's American Family Plan suggests making those permanent. It also, as I think Adela spoke to earlier, and the Senator as well, expanded subsidies to folks who didn't used to qualify for subsidies because they made too much money. So now a broader swath of folks are eligible for those subsidies, and that's really the most impactful and significant step towards affordability that we can take today.
Adela.
Yeah, I agree with Kathrine on that with the ARP enhanced subsidies. And then I will also say that the state policies that have been put in place last year and state policies that have the potential to pass this year will also have a significant impact on access and affordability. We had a question in the chat earlier about people who are in the family glitch. And so there was legislation passed last year that will help bring state-based subsidies to those people who have been in the family glitch and unable to access subsidies to purchase in the individual market. So I think those are all game changers.
Great, thank you to our panelists. And I do want to do a call out. Open enrollment is going on now, and it will go through August 15th, possibly later, but right now, August 15th. So do take advantage. And if you're employers, you can still take advantage of those individual market rates through an ICRA as well. But so this is an unprecedented time with an open enrollment, American Rescue Plan subsidies, and businesses starting to reopen with COVID. So there are opportunities out there. I'm going to turn it over to Blair. Blair, thank you so much for co-hosting this with us. We really appreciate our partnership with the Summit Chamber and with the chambers in all of our communities. But thank you so much. This was just great. I will turn it over to you.
Thank you, Claire. Thank you to our panelists. Thank you to all of our participants. We do have had a great lively conversation going on in the chat and a lot of questions in the Q&A. And so if we did not get to those, we will follow up with you. And this is also being recorded, so it will be available for a short amount of time after today for people to view as needed. And I will just echo what Claire said. You know, we are so grateful for our partnership with Peak. If you have any questions, please do not hesitate to reach out to any of us. We're happy to have that conversation and really continue this really fantastic conversation that we were able to have today. So thank you all. Thank you to our participants, and hope you all have a great day. Thank you.
Thank you so much.
Bye-bye.
Thanks for having us.
Mhm.